The U.S. National Registry of Emergency Medical Technician has established a standard for emergency medical service through its accredited certification programs. There are three levels of certification for an emergency medical technician, or EMT: EMT, AEMT, Advanced EMT, and Paramedic. All three levels require the completion of an appropriate course based on the national standard curriculum. However, specific EMT certification requirements vary by state. Certification requires extensive training. EMT and AEMT certifications can require 90 to 500 hours of classroom instruction. Paramedic certification generally requires 1,200 to 1,800 hours and may even require an associate's degree in paramedicine. To become a paramedic, you must have prior EMT or AEMT certification. Certifications are usually valid for 2 or 3 years, depending on the state. Most states also require EMTs of all levels to participate in continuing education courses. EMT certification requires training in basic life-saving procedures and other skills needed to fulfill the duties of the job. EMT responsibilities include the following: operating vehicles, administering medical care to adult, pediatric, and trauma patients, administering CPR, using an automatic external defibrillator, AED, treating wounds, assisting with childbirth, administering certain medications, responding to environmental emergencies, comforting and reassuring patients, and lifting and carrying patients. Advanced EMT certification requires EMT certification and additional training in advanced life support procedures, and AEMT serves as a link between the emergency scene and the healthcare facility. As part of an advanced emergency medical service team, the AEMT provides transportation and limited advanced emergency medical care. In addition to EMT procedures, AEMT duties may include the following under the supervision of a physician, registered nurse, or paramedic: initiating and maintaining intravenous therapy, drawing peripheral blood specimens, treating respiratory emergencies, performing advanced airway procedures, interpreting cardiac rhythms, providing emergency pharmacology, and performing cardiac defibrillation with a manual defibrillator. Paramedic certification requires training in all of the basic and advanced life-saving skills for EMT and AEMT certification. Training in the following areas is also required: assessing patients, mitigating trauma and hemorrhage, performing advanced defibrillation techniques, performing advanced life support in resuscitation of patients in cardiac arrest, providing emergency diagnostic and treatment procedures such as stomach suction, airway management, and ventilation, and cardiac monitoring during patient transportation, administering drugs and performing intravenous procedures, documenting, which involves observing, recording, and reporting to the physician the patient's condition or injury, the treatment provided, and the patient's reactions to drugs and treatment. Communicating with dispatchers and treatment center personnel, providing information about the emergency, arranging reception of patients, and receiving instructions for further treatment. Remember, EMT certification requirements can vary from one state, municipality, and department to another.